Beyond Zero, a partner in public health transformation, took to Limpopo province where doctors, nurses and patients testified about their encounter with Beyond Zero.
Then was called to or invited to attend a Beyond Zero advanced clinical care course in 2016 June, and I was part of the first group that was given the talks in terms of HIV related cases. We attended firstly a 2-day course where it was more of an introduction of matters related to HIV. We started with virology, immunology, we did clinical cases, and there was a whole lot of talks concerning the guidelines and updates in the guidelines. From there, we then had a second session in the same course of Beyond Zero, which then included a more practical way of seeing HIV. Also, there were talks, especially one that I was quite interested in, which was the PMTZT. Also, in that second session, there was an examination at the end and an assessment where we had our MCQ, which was a written exam. From there, we had our oral exam. So it was quite an interesting course. I learned a lot, and just like any other doctor that attends such meetings, I was clueless, or rather didn't know much information about the advanced clinical care, about the updated protocols, until I went to the Beyond Zero program.
I came to know Beyond Zero in 2016 when we had an invitation that they need someone to be trained for advanced clinical care. When I went to that workshop, I had unsolved problems, and I told myself, I'm going to give them my problems. I will see if they can help me. We went to that workshop in Polokwane for 5 days, and our challenges were met. When we came back, we felt like we were well capacitated because all the challenges that we had, we were able to handle.
Beyond Zero makes it easy for people to speak freely about their situation.
Unfortunately, I never know what is wrong with me. I got sick, very much sick. I think I was on that stage of saying bedridden stage. The fortunate part of the story was when Fizo came, Sister Lelaka, and then she saw me not good, but she never spoke to me like a professional nurse or even a mother or sister. She just came there as somebody who cares, and then asked me why did I come for wellness. I was still afraid because there was this so-called stigma and discrimination that was all over HIV and AIDS story. I don't blame anybody for that. The way HIV and AIDS story was brought to people, it was a fearing story. People were afraid of accepting anybody with HIV. So when we hear that people with HIV, they die, they will never get cured. So everybody, the mentality tells you, once you're positive, you're going to die. So you die before your actual time, because already fear is conquering and it's clouding your judgment.
Let me say all the chapters with that 28 payment. At the end of that month, my blood should be dropped. So I have to be transfusion. They called all the doctors in the hospital. They tried. They worked very hard for my transfusion. They were so surprised. Why I have to be transfusion every time? Some of others, they think maybe I'm not taking my medication. So they realized that this medication is not working. They called this helpline, AIDS helpline, and that is when they get the solution. Those that worry, they must change that tablet for me. They must change that regimen. I must go to the second regimen. That's where I found my solution. Since that it was on May They turned that on me. Since that one, my viral load, I remember it was 63,000 viral load. So I take that medication, the second line, for only 1 month. When I come back, when they test my viral load, it was dropped to 45. That's where I get my life. I just want to thank them, all the sisters and the doctors. You've done a good job for me. Thank you very much.
Kule umamami until the age of 4 years, 2003 washona. Then lapho bengazi ukuthi ama HIV positive. Uthatha lapho bangisusa bangisa eMpumalanga eKwaga la ngathi umhlala khona ugogo nabokhaya nabomalume. At that age bengazi ukuthi I'm HIV positive. So ngathola ukuthatha treatment kwaNdlovu siyakuzwa and some of this side and to treatment lapho ngayithatha at the age of 10, yeah.